your daughter has lost her virginity and she's not yet married, bring her to a plastic surgeon, okay? And then we can restore the hymen. The woman feels whole, okay? And this is because you feel your anatomy has been restored back to normal, okay? So that is number one. The satisfaction rate is very high. It's actually above 90%. Before even we go to the skin coming back to normal and all that, just immediately after the surgery, the satisfaction rate is high. Okay, that's number one. Childbirth at least is made easier for those who unfortunately were stitched too much. So you can understand why for them it's actually an emergency. To do the FGM reversal. Okay. So the advantages are many. If you look at the vulva, the female genitalia, you have your clitoris, you have the inner lips, and we have the much inner lips. And then now you have the introitus. The introitus now is what people usually know. That is actually the vaginal canal. So for the lips, you have the outer lips, which is the labia majora, and majora means major. Okay? And then we have the labia minora that are just inside the labia majora, which is like Korea. That is huge market, making the area beautiful. And it involves very many things in aesthetics. So they take care of that particular area the way you'd take care of the face. Yes, so I think in a few years, Kenya will also be there. Patients who probably have very small breasts and they want to go a size bigger or 2 sizes bigger, then we put what we call breast implants. So that is, in layman's words, plastic. Yes, the men. We've had some men who feel the bum is a bit big, they want it reduced, and that we can do.
How do you go about that?
So if a man wants enlargement, we're able to cater to that. Yes. Now, this is not the one for pills, take a pill. No. So if you want increased width, then we do the fat grafting.
Hello people, Susie Diadem, living positively regardless. Doesn't matter the point at which you are in life, but we rock positivity all the way. I am born again, I am reconciled to Christ, and I am proud about that. I want to invite all of you who have been watching us. I want to come all of you, so that I give you a big thank you. Yes, thank you so much for keeping it here at the Susie Yule Diadem. Thank you for watching our videos. Thank you for sharing them. Thank you for your comment. Thank you for the new subscribers. Welcome to this family. We are doing well and we are growing. And if you have a testimony that you think is inspirational, you'd want to share with the world, you want people to know where God has brought you from, please don't hesitate to talk to us. Our contact is down here. Just call us, or you can come to Facebook, inbox me from there. TikTok, we are there. Inbox us and tell us you have a story that you want to give. If you have something educative that you want to bring awareness about in the society, and you would wish to use our platform, again, you're much welcome. Use the contact below and let us give you a chance to come and share with us. And today, guys, is one of those days I get excited when I have a guest, and not to your usual guest. But before I tell you what it is about, let me first of all give our guest an opportunity to look at the camera and say hi to you. Hi, Mercy.
Hello, Susan.
I'm so happy to see you.
Thank you so much for having me.
So beautiful.
Thank you so much. You're looking amazing as well.
Thank you.
Yeah.
Karibu Susie Yule Diadem.
Asante sana.
Yes, and I want to give you a chance to look at the cameras. Say hi to people.
Hello, subscribers. I'm happy to be here. It's such an honor and a privilege to be hosted today by Susie Yule Diadem. Yes, thank you.
And so guys, today we have a doctor in the house. Yes, a doctor in the house.
My name is Dr. Makena, a plastic reconstructive and aesthetic surgeon based in Kenya.
Because today we want to talk some of, of course, in the past, we have brought like 2 topics that are a bit uncomfortable, and we are telling you that the reason we are doing this is because the other day we were talking about pornography, and we want to talk about it in whispers because we want to pretend it's not happening. Unfortunately, it's happening. It is in our houses. Our children are watching, and so we were saying, I think it's time we just get bold in these things, because whether we are bold or shy, it will still continue happening.
That's true.
And we understood the mental effect that it has on children. So today is one of these days. Again, a rare, I feel for me on my side, maybe to you, you will tell us. For me, I feel like it's a layer.
That's true.
Topic.
Yes.
But then now, before I introduce the topic of the day, I want our daktari to give just a little background of yourself professionally, who you are.
Oh, thank you. Okay. So I'm Dr. Makena Ndege. I'm a plastic, reconstructive, and aesthetic surgeon. So my degrees are Bachelor of Medicine and Bachelor of Surgery. And I mastered it, and I majored in Masters in Plastic, Reconstructive, and Aesthetic Surgery. So a total of around 10 years in school, medical school. Then other than that, I'm a trainer in aesthetic medicine, and I'm a specialist in FGM reversal. That's female genital mutilation reversal surgeries. So basically, we can just say I'm a surgeon who loves working on women, with women, to give you your ideal body. Yes.
Okay.
Yeah.
Wow. When you talk plastic, we are afraid, because just in recent time, we have seen in news that a lady went for reconstruction. She wanted her boobs. I think she wanted them bigger than the way they were. Most of the time, we are used to trying to reduce them, but I think for her, she wanted bigger, and she lost her life. So you're saying it is medically accepted?
Yes. So as long as you go to a certified plastic and reconstructive surgeon, meaning you have to do your research and you have to research the clinic that you're going to, as long as it's a specialist in that particular field, then you should be safe. Okay. Of course, there are dangers to each and every surgery, even something as small as, just removing some fat, some lipoma. Of course, we have dangers. That is a given. But we try and mitigate the dangers, by going to well-trained individuals. As I said, I have over 10 years training in the medical field. And this is minus my work experience. Yeah, this is just training. Okay. So yes.
Before we get deeper to that, I've had one of the doctors, a very young one, actually a graduate, and the other day he was with Mheshimiwa Honorable Miri Odhiambo, and he was really lamenting that they are wondering, why are we going to school for all these years and then we are not getting the jobs that we were really looking for.
And we are going through a very tough season in the health sector, especially in terms with the health workforce. In this time, the statistics are really bad, because according to WHO, the doctor-to-patient ratio should be 1 to 1,000 patients. Currently in Kenya, according to the KNBS standards, which is a government institution, place it at 1 is to 5,263 patients, a big gap there. And we are training doctors, which is a very good thing as a country. I think every year we have at least 1,500 doctors who are graduating. I'm one of them. But how comes we are not seeing these numbers in the hospitals? How comes these doctors are adding to the list of unemployed youths in the country? What do you think is the problem, and what do you think should be done to help in this?
Again, as I told you earlier,
yes,
we are having a challenge as a country right now.
What is your comment on that?
That is actually very sad, and I do empathize with my younger colleagues. For me, I've been fortunate enough to just be able to pass through. I was among the cohort that was actually posted by the national government. So after medical school, I got my internship to Kitui County. I was actually sent there by the government. And then immediately after that, I was posted to Turkana County, again by the by the county government. It was just as we were getting to devolution. So for me, I've never really struggled with work. The government has been quite fortunate. It's actually the government that took me back to school to train in plastic surgery. So I've been a fortunate, how do I call it? The government has been kind to me.
Yes. A word of hope to them that are feeling we are unfortunate.
What I'd say is look for opportunities, not only within Kenya, but also abroad. So if you are unable to find work here and abroad, maybe you can start your own clinic with the very first degree, the Bachelor of Medicine and Bachelor of Surgery. I think you can start something. And I've had colleagues who just started with a desk and a table. And this is not those stories of I started a butchery with just one piece of meat or one egg. Yeah, you can just start small, and then you grow organically from that. Yeah.
So there's no time to sit down and regret the fact that you went to school for 5-8 years. You're saying don't regret. You can
don't regret. Take advantage of whichever position you're in. It's very sad. And I do know some of my younger colleagues have even taken their life because of the depression. Some parents have actually taken loans to educate their children. And then when you come out, there are no jobs. I do believe you can even do something on the side as you're gearing up to start your own clinic. And then hopefully God will make a way. Yeah.
Talking of people taking their lives, I remember there was also a case that was said the doctor actually got the opportunity to work there, but it looks like the picture they are portraying is that the environment, the working environment there is too harsh, and they got to depression and they committed suicide. What is happening there?
Now, I am not one to judge because with depression and mental illness, some have a susceptibility to becoming very sad, and also your upbringing and the experiences you've had in life. Some might harden you and some might weaken you. For me, in my case, I'm not able to talk about other colleagues or other individuals, but for my case, you see, I was posted to Turkana County. To most people, that is a marginalized area. That is a no-go zone. And this was back in 2015. Okay. So I think I was among the second female doctors, the second female doctor to be posted there. Yes, there's one who was already there. Hello, she knows herself. Yes, so I think if you're able to take in stride and look at this as new opportunities, and everything has something to teach you. One thing I can say about myself is I'm very adaptable. Okay, so when I'm there, I forget Nairobi totally. And I just assimilate, and I loved it, despite even the hardship. You
didn't even fear for your life. That's what normally we say.
Now, I think now that is a matter of personality, because you see, even the fact that I'm doing surgery, I do like challenging situations, challenging areas. So that might be a thing about my personality. I enjoyed it there actually. Yes.
So for you, every challenge is like, let's what
I like
can
that.
do.
I like because it pushes me to the limit. And then once I'm pushed to the limit, then I realize I have much more to go. And it's like the doors open, because they either open or they open. Yes.
All right. The reason we are here, guys, we want to restore the dignity of a girl child. We want to bring back the confidence of a woman being a woman and being a lady. And so if you're a woman, you cannot miss on this one. If you're a man, of course you want a woman who is confident, a woman who can go and get to her dreams. But one thing I know is that stigma and low self-esteem is a stealer of dreams, because it makes one not to go to achieve their dreams. So whatever we are discussing today, as we restore the dignity, the confidence of this girl child, it will also work well for you brothers who have these sisters at home and they have gone through FGM and all these things that we want to talk about today. Probably I may get a better body after this.
You look amazing.
You're not looking at me and you're saying, I can add this, I can remove this.
No, for me, unless I actually think you need it. For me, I look at the ideal body, according to me, of course. But we ask the patient, what is your ideal body type? And then we try to give you that. So if I feel you look quite good. I will not go out of my way to tell you, you need to do this and you need to do that. I believe that is body shaming.
Okay.
So I am not one to body shame. And also part of the reason I got into plastic surgery is to get rid of the body shaming. Yes. So I'm here to offer solutions.
Okay.
Yes.
Because I love that. The body shaming comes because what is ideal for me may not be what is ideal for you.
Correct.
So you may be thinking I'm just okay, but me, I'm feeling I need a touch up here and there.
Exactly.
So that's where you come in.
Exactly.
Wow. So let us start from somewhere. FGM. First of all, maybe for some of us who just know, well, we know the term, but we don't know exactly what happens when some people go through FGM.
Okay.
What is it about?
So FGM is what we call female genital mutilation or female genital cutting. So you'll find most of us saying FGM stroke C. Okay. So this is where the clitoris is cut. But according to the WHO classification, we have types of FGM. So the very first type, we call it type 1, is the FGM where the clitoris is cut. Of course, we subdivide it such that 1A, the prepuce is just cut. Okay, prepuce is the hood that usually covers the clitoris. I'm sure women, you know what I'm talking about.
I think even men know that.
Okay. Yes. So type 1.
Okay.
You can either have the prepuce cut or the clitoris cut, or you can have both cut.
No, prepuce is the top one. You know,
Yes,
we may
the
be
hood.
having them, but we don't know what they are.
The
So
hood.
the very top.
The skin,
the caskin
the
up
caskin,
there.
yes,
Okay.
yes. So, but the clitoris is the nub. We call it a bin. A better way to describe it, the small bin.
The loose cocoa now here.
Yes, true. So it's very sensitive, and that's why it actually needs the hood, so that it's not exposed. Okay. Then, so that is type 1. Type 2 is where now the labia minora. So if you look at the vulva, the female genitalia, you have your clitoris, you have the inner lips, and we have the much inner lips, and then now you have the introitus. The introitus now is what people usually know. That is actually the vaginal canal. So for the lips, you have the outer lips, which is the labia majora, and majora means major. Okay? And then we have the labia minora that are just inside the labia majora. So these are the ones that can actually grow to be very long, and some women say they actually want it reduced, what we call labioplasty. So type 1 is cutting the clitoris and the plus or minus cutting the prepuce. Type 2 is you also include the labia minora together with cutting the clitoris. Okay. Then type 3, now here is where it gets a bit tricky. For some, they can cut also the labia majora and then they stitch it, what we call infibulation. Yes, it is quite sensitive, but the entire point of type 3 is to reduce the vaginal canal. Okay. So if you find the external genitalia has been cut and then stitched together, leaving a very small hole, that is what we call infibulation. So that is type 3. We also have type 4, which is anything you do to the female genitalia, from ear pierce, it's not the ears, from clitoris piercing, any small nick or trauma to the aesthetic trauma to the genitalia, even iatrogenic. Iatrogenic is induced or caused by either yourself or someone else. Okay. Yes, that is type 4. It is neither here nor there. Right. But what I want to concentrate on is step 1, 2, 3, and the severity increases as you go higher. Yes.
I want to smile and not to smile really, because I'm imagining, why do we pierce for beauty?
For beauty, for sexual stimulation of yourself or your partner.
Okay.
Yes. So,
wow.
To each their own.
Again, you said
each
not
their own.
judging, everybody
Yes, to each
has
their
it.
own. Yeah.
All right. So now, what is really the idea? Well, that one we know is for beauty and all that, but the general FGM that we know,
Yes.
and that is, I think, culturally accepted in some cultures. What is the idea behind FGM?
So from interrogating most of my clients and patients, what I've had is most of the times it's actually the grandmothers and the mothers who take these young women to go to a person who's well known traditionally to conduct that particular act. So the thinking of the mother or the grandmother is not malicious. Okay, so what I've come to learn is they do it so that they can preserve virginity. And this is why it's very common in the communities where virginity is highly regarded as the norm before marriage. Okay, so they want their daughters or their granddaughters to be married as virgins because it increases their worth. So that is the thinking behind it. And in so doing, when you cut the clitoris, you reduce the sensitivity. The sexual stimulation is reduced. So in so doing, chances of the young girl getting to marital bliss as a virgin is higher. Okay. So in type 3, the fact that they actually teach it is just going a step further to ensure that virginity is preserved. So that is usually the thinking behind it.
Okay.
Yes.
So the idea is good.
The idea is good, but the method might be traumatizing to those who undergo it, and probably because they do not know that there might be a solution. So the thing about plastic and reconstructive surgery is, yes, we are able to reconstruct the clitoris, but other than that, and now this is why I became interested in doing something called hymen restoration. So if in your community, virginity is a big deal, your daughter has lost her virginity and she's not yet married, bring her to a plastic surgeon, okay? And then we can restore the hymen, okay? Reason being, the hymen is still there. It was broken, yes, but the remnants are still there. So you can stitch the hymen back, and she's as good as new. You understand?
Yeah.
It's a bit of a taboo, but
you are saying there are no virgins remaining. Come and see us. You're saying you can restore virginity.
yes.
Okay.
Yes.
So we can have a
physical virginity. Now the psychological virginity, that one might be gone.
No, that one will work on. I first want these, because as you say, although nowadays I think the whole thing is changing.
Yes.
I think some days back, virginity was really, really valued.
Yes.
And every man want to marry a virgin.
Yes.
Without telling us whether them themselves are virgins. But can we get to know whether a man is a virgin or
Unfortunately not.
Or we cannot.
Yes,
Even
that is
with the
secret.
surgeries and all this.
No, we cannot. No,
the one reason I get
yes.
to think God has more nature of a man.
Yes.
Because man seems like he was really, really favored.
But now we've evened the playing field.
Oh yeah.
Yes, now we have. With the surgeries, no one has to know.
Okay. So we can have someone who has given birth but they are virgins.
That's true.
Wow. Now, in the first place, the idea now from your profession point of view, the idea of FGM, is it necessary? Do you think the idea that our grandma had and our moms, that they want to make us pure?
Yes.
Do you think it's necessary?
Now, for me, I do not hold any opinion on the matter because I've really interacted with the various communities. Okay. I do not judge. I do empathize with those who've undergone FGM, okay? But I will not bash the grandmothers and the mothers, and that's why probably we are hosting this show to tell them there's a less traumatizing solution to this problem.
Okay. Rather, my question even was that what we were trying to achieve in this, that we want to reduce the immorality,
yes,
in quotes, is it achievable through that way? Are you also trying to reconstruct women to make them better? Like, okay, the idea is to make me pure before marriage.
Yes.
Right?
Yes.
Meaning I'm not practicing sex.
Yes.
So how does it help me not to practice sex now that I've gone through FGM?
So number one, the sensation, the sensitivity of the clitoris is gone. Okay, because the nerves that are usually at the tip have been cut off. All right, so that is for type 1 and type 2. When you stitch during coitus or the sexual act, number one, the hole becomes extremely small. Okay, so it will be quite traumatizing. Okay, someone might argue it's no different than when you have the hymen, but this is different because this is actually muscular tissue. This is, yes, so it's actually quite traumatizing and painful. Okay, and not only that, even now we come to what we call the complications of FGM. Number one, their sexual libido decreases because it's painful. Okay, because of the scar tissue, it's painful. Okay, so anytime you're going to feel pain when you're having sex or when you're attempting to have sex, most of the times you're going to shun it. Okay, and most of the patients that we get, some even have already had children, but they just do not enjoy sex.
Okay.
For them, it's just, to get children. They do not enjoy sex, and they also have a psychological, is it discomfort or disturbance because of whatever they went through? Because, most times it happens during puberty. So you actually are traumatized by that very act. Okay, so did it manage to control the purity of those who underwent FGM? I think to a large extent it has.
Okay.
I think it has. Yeah.
So what exactly now do you do to them? Now I've come to you and I've gone through FGM. So one of the things, the impact you're saying, psychologically, that person may have still carried the trauma with them. Then secondly, it could be painful for them. And I cannot imagine that anytime you want to enjoy sex, because sex is supposed to be enjoyed.
Yes.
But now anytime you want to have it, it's becoming painful.
Yes.
So how do you help these women?
So for those who have undergone, for example, type 3, okay, we actually open up. Because it's a small hole, we open it up, okay, to create room so that even the act itself is not as traumatizing as it was before. That's number one. Number two, for the women who have already had the FGM, especially type 3, and then they had unprotected sex, and then they got pregnant. It increases the chances of obstructed labor and tearing during childbirth.
Oh.
Yes, because you understand it's still the same place. Okay, so we try also to minimize the risks that come about with this. Okay, and that is not the only thing. Some actually, because of the act, because you understand it's not done in a hospital setting, some even get cysts, huge growths in that area. Okay. Because of what we call probably a bit of skin was left inside, epidermal cyst, So it has a lot of, it has very many complications. Not to mention even during the actual FGM act, okay, a patient can actually bleed, what we call hemorrhage, go into shock, meaning they've bled too much, okay. They can also get infected. Okay, so the entire area might be very infected, and it can even give you infection. The entire body can actually be infected, what we call sepsis. Yes, so there are very many risks other than the pain and the psychological issues that arise with that. Yeah.
I've been wondering why because we have been told stories that our shows, they were actually the ones that were looking for a second and a third wife for their husband, and we have been wondering, was there no jealous or anything? But now I think I'm starting to understand because some of these things can make you even hate marriage in the first place.
That's
because
true.
Every time you're having sex, you're feeling pain.
That's true.
Now there comes complication with even giving birth because of heavy bleeding.
Yes.
And then there were no treatment like we have today.
Exactly.
So why would you and I not look for someone else now to help me give birth and do all those things? Huh?
Yeah.
Wow. So now you come and you restore that whatever had been taken away.
Yes.
And the sensation is able to come back.
Yes. So for some, they are actually able to achieve the entire sensory feeling. Okay. For others, it might the sensation might come back, but probably up to 40%. So when a client or a patient is coming for this particular surgery, the very first thing we tell them is, number one, it is for sexual healing. Okay, sexual healing and psychological healing. Number two, the sensation might be regained, but not to the extent that it was before. You understand? The nerve endings were at the tip that was cut. Yes, you'll still have nerve endings because it's still the clitoris body is huge. So there's what is seen outside, but there's still the clitoris body that is inside, that is hidden, that was not seen and was not cut. So that is actually what we actually exteriorize. We remove it during the surgery. Okay. So whatever is inside, we bring it outside. Okay. So whatever is there has some nerves, but at the end of the day, you might need to stimulate these nerves so that they can regenerate. Now this, and here I put a disclaimer. This is for the communities that accept stimulation of the clitoris after surgery so that the nerves can regenerate. Stimulation, we use vibrators. You can also ask your partner to help, regenerate the nerves, or even by yourself. What now? This is medically prescribed.
So once it is stimulated in the hospital, it regains the normal. So now
No. We're not the ones who stimulate it.
Oh, okay.
No, that is for you. For the client, for the patient. Yes, because that starts after 2 months.
Looking at me as a client, that's it for me.
Sorry. Yeah.
So once it is done once, it's now able to regain the healthy, normal way of a woman feeling, or rather enjoying sex.
Yes, slowly with time.
Okay.
Yes, with time. Healing takes time. Yes, but you're only supposed to do that after 2 months, not immediately, because it becomes a wound. I'm sorry we cannot show the photos, but to those who've undergone the surgery, they understand why it takes time for the skin to come back to normal, what we call epithelialization, because at first, after you remove the clitoris from inside, it is raw, but then it gets that nice top coat, if I can say. Okay. So that takes from 6 months to 1 year for it to come. Then after that, it's all systems go. So most of my clients from week 2, they already started trying to stimulate the nerve endings, but we try and tell them to wait.
Yeah, because Daktari, I'm wondering, you're telling me to eat for a whole year.
No. Now, the thing about that, not waiting in terms of sex. What I'm saying about the skin coming back on that particular tip, okay, is from 6 months to a year. But for sex, we ask you to continue with sex from 6 weeks after the surgery. Okay. It's the same as after giving birth. You're told to abstain for 6 weeks.
No, 6 weeks is a bit fair. Now the one was the one we were having a problem. Me and them. I know you also had that, right? Oh wow! And I like the fact that you've said it's still what is in our body, because I thought it's something that plastic you're going to put there. So you are telling us without clitoris, or rather without the sensation, it's hard to enjoy sex.
Now, that is something we can debate about. Yes, because you understand we also have what we call the G-spot, which is not in the clitoris. It's actually found inside the vagina, behind one of the walls. So this is sex education. Sex education. But I do know that the clitoris helps lubricate, and it plays a big role in the stimulation. Because most of my clients, to be honest, they say they don't feel anything during sex. And I have never thought to ask, any of them, what about the G-spot? But
okay.
That's
don't ask us what is happening in CBD when we are still in Githurai. At least when we're in Pangani, we can try to zoom in and see what is happening in CBD.
True. That's very true.
Wow, beautiful. Yeah. So now when you are reconstructing this and giving back this dignity, what are the side effects? Can it maybe come back and then make things even more worse? What are the other side of it?
Okay, so what I know is the positives first. Immediately after the surgery is done, the woman feels whole. Okay, and this is because you feel your anatomy has been restored back to normal. Okay, so that is number one. The satisfaction rate is very high. It's actually above 90%. Before even we go to the skin coming back to normal and all that, just immediately after the surgery, the satisfaction rate is high. Okay, that's number one. Number two, definitely the sensation is back. If the introitus was made a little bit smaller, childbirth at least is made easier. For those who unfortunately were stitched too much, and during periods, instead of the periods finding a way to come out, what we call hematocolpos, instead of the periods finding a way to come out, they're just retained inside. So you can understand why for them it's actually an emergency. Yeah, to do the FGM reversal. Okay. Yeah. So the advantages are many. Disadvantages: bleeding. We don't have major blood vessels there. Okay, so bleeding is usually minimal during surgery. Okay, because what you do, you just make a nick where the old scar was. Okay, so you make a nick. This is just for type 2 and type 1. You make a nick, you find the clitoral body there. Okay, and then there's what we call the suspensory ligament that usually attaches the clitoris that's inside. So that is what we kind of separate a bit, and then it becomes loose, and then the clitoris comes out nicely. Okay, so probably some infection, some local infection that we actually control, and this is just one of the complications that will happen if probably your hygiene or the steps that we usually give you immediately after the surgery are not adhered to.
Okay.
But the complications are very, very minimal.
Okay.
Yes.
Wow.
Of course, other than anesthesia risk and all that, the complications are minimal. And it's actually a very fast surgery. You come in, 1.5 hours later, you're out. Hello. My name is Dr. Mercy Makena, a plastic, reconstructive and aesthetic surgeon based in Kenya. And today's case is one of clitoral restoration. So the particular surgery that I'm about to begin is called clitoroplasty, and it is done to women who have undergone female genital mutilation or cutting. So the purpose of this surgery is to restore the clitoris, and in so doing, we are able to at least help the woman feel a little bit more whole and also give her psychological reassurance and also restore a bit of sensation in the clitoris. So we're just about to do the surgery. The surgery should take 1.5 hours. The patient is prepping outside, and in no time, we'll start.
Okay.
Yes, so you just rest for 30 minutes.
Back
Yes.
As a virgin. Okay.
No, not a virgin. As a lady with the clitoris. Yes, as a lady with the clitoris. The one for the virginity is different.
That's
a different surgery.
We are
Yes.
coming there to
Yeah.
know about our virginity, because
Yeah.
I think once we receive a character development, you're about to stop this thing we talk about body count.
Yes,
you're
yes,
about
yes.
to stop the
No,
whole
no, no.
nonsense.
Yes. We are doing away with that.
Okay.
Yeah.
Now, this can I feel normally? I've not gone through FGM, but I feel like these lips are not having a good shape. I would have rather have them this way.
Yes.
Or rather, this clitoris does not look so beautiful.
Yes. Now that
You
is
do?
yes. Now that is aesthetics, or what we call cosmetic gynecology.
Okay.
So we do that. So what we call labioplasty. Okay. So sometimes you might feel the lips are too big. You want it, or the shape is a bit funny. You want it refined. Okay. So that we do. Now that is the beauty about plastic surgery.
Okay.
Yeah. So we can restore form. Meaning, probably if you are traumatized and you have probably a wound or a dent, okay? So we try to take you back to normal. But if you feel, fine, I'm normal, but I want to be better, we give you that.
Who are
that
these
extra
people?
oomph.
Who are these people?
That is where we are going to. There are very many, both men and women. Very many men and women are taking the bull by the horns and saying, no, I'll be what I want to be in this lifetime.
Because I've heard many people saying that that area is not a beautiful. Actually, I hear people when they are fighting online, they are wondering, what is this that when maybe women are fighting and they are asking each other, what is this that you're feeling proud about?
Yeah.
This thing is so ugly, nobody want even to look at it.
Now, shockingly, in countries like Korea, that is huge market, making the area beautiful.
Wow.
And it involves very many things in aesthetics. So they take care of that particular area the way you'd take care of the face. Yes. So I think in a few years, Kenya will also be there.
Okay.
Yeah.
And why are you calling it plastic surgery when actually you're not adding anything artificial?
Now, because the umbrella is trying to cover everything. So we do put implants. So for example, in patients who probably have very small breasts and they want to go a size bigger or 2 sizes bigger, then we put what we call breast implants. So that is, in layman's words, plastic. Okay. For those who have very small bums, okay, or gluteus in scientific terms, that's the buttocks. Okay. If you feel you want to go sizes larger and you do not have enough body fat for us to transfer to give you what we call a Brazilian butt lift, we can also give you implants.
Okay, don't take us too fast.
Yes. So,
Take us slowly.
Yes.
Because I want to understand how you do this, and we will do it one by one.
Yeah.
So I'm going back to, clitoris, I think we are good. We are good with our clitoris becoming beautiful. I think we are good. Now, I want to understand about the hymen.
Yes.
How do we retain back maybe even before we get out of the clitoris, do you think there are other issues that interfere with our clitoris, like maybe childbirth, apart from FGM? Are there other issues?
There's some practices that would interfere with that. For example, pulling. And I think this is, I don't know whether it's practiced in Kenya, but I know the neighboring countries do that. So they pull the clitoris to make it longer.
Jesus.
Okay. So for them, that is culturally done to increase sensation, of course, and beauty. Yeah.
Here we are reducing. The others who are actually pulling it.
We've seen it all. We've seen it all. Yes. Yeah.
Childbirth cannot affect that.
No, it cannot. Let me just say
no sexual practices, I mean styles, for lack of a better word, can interfere with that also.
I don't know all the styles that are there, but other than the piercings, what I do know is that we do have those who practice extreme sexual practices, okay? The BDSM, the bondage and stuff. But I have yet to see any client or patient who's come to me because of probably going to that extreme.
Okay.
Yeah.
What I was trying to look at is that, again, our clitoris is not such a so sensitive thing that we are very careful that I don't want to do this so that it doesn't get affected and all that.
What I do know, there are men also, actually. I've had stories of men who actually cause a lot of trauma during sex to the clitoris. So probably that is not part of FGM, but I do know such patients, then we are able to maybe just do a little bit of wound healing and all that.
Okay.
Yeah.
How are we making a mother of 2, 3, 4 a virgin? Let's get to that.
Yes. So virginity, of course, is a state of both physical and also the mind. Okay. So what we're able to restore is the physical virginity. So what usually happens during sex or coitus is whatever you're using to break your virginity, it's like probably a piece of paper, and then you box the piece of paper. So what is left, I don't know if you have a piece of paper, then I can, let's say this is the vagina, okay? So maybe you can hold this for me. Yeah. So this is the introitus and this is the hymen. So if this is probably the penile shaft, so if it's perforates like that, okay? So you've broken the hymen. But what is left is the remnants, these pieces. So sometimes it's totally tattered, like this. So during sex, you'll not be able to see, of course. Some are, it's stuck to the sides. So you have this, okay? So it's our work to get the pieces and reattach. So you stitch the pieces back, and you're back to as good as new, if not better.
Okay.
Yeah.
So actually, what they told us, we lost our virginity. It's just that we we disorganized the house. It is still there. It is there. It's not lost.
It's just some hiding there behind.
And you're saying, I like the way you're saying some are like this, the way you are tearing.
Yes.
So it depends with whoever is breaking how far they can go and what they can do.
That's true.
Wow. So you're just bringing it
You
back.
just bring it together and then you stitch.
Okay.
Yeah. Yeah.
Apart from, does it have any other health benefit apart from the sexual way of feeling you're good? Because I'm imagining in the next sex encounter, you still break your virginity, right?
Of course.
It was meant to live.
No. It will still be broken.
So does it have any other maybe health advantage, or it's just
None that I know of.
okay?
Yeah.
So it's just for esteem, just to feel good,
And for fun, of course.
and for fun.
Yeah.
Sure. All right. So now I've come to you, Daktari. I'm feeling that my bamba mal kidogo or
Yes.
even are too big. Do you have people who want to reduce them?
Yes, the men. We've had some men who feel the bum is a bit big, they want it reduced, and that we can do.
How do you go about that?
So if it's mostly fat, then you can do liposuction, and that is what we mostly do. So the other one of if the bum is too small, you want it increased, then we do the reverse. So we put fat in it. Okay. So the good thing about fat is it's your own tissue, so you do not become allergic to it. Okay. So if you want to go very big, then we do advise you do what we call now fat grafting, what we call Brazilian butt lift. Okay. So you take fat from the abdomen, from the thighs. Okay. We process it. Okay. In theater. That time the patient is totally knocked out. Okay. What we call general anesthesia. So we process it and then we put that particular fat into the buttocks and then we shape it. Okay. Yes, so it's a procedure that should be done by a plastic surgeon, a certified plastic surgeon, and it should be done in a very sterile theater. Okay, you do not want infection, and also it should be done in a clinic that is known. Okay, a plastic surgery center or a hospital that is known, to avoid mistakes.
These things we are discussing here, you're saying they are legally accepted and professionally accepted here in Kenya, not out there,
Yes.
here in Kenya.
Yes, we do. Yes.
Okay.
Yeah.
So if I want, you said shaping it, I'm imagining you now doing my bum bum.
Yes, like a clay pot. Like a clay pot. We call it contouring. You try and make it just, look nice.
Okay.
Yeah.
If I wanted a V-shaped bum bum, I can tell you, please make.
We'll have that discussion as you, the client, will ask you, why do you want the V-shaped? And shockingly, it's not all patients who come for surgery that we say yes.
Okay.
Yes, we have to make sure that psychologically you do not have any illness or ill will towards your body. Yes, so at least that I must say.
Okay.
So there are conditions that if we feel this might be a psychiatric issue, then we will not operate on you at all.
Okay.
So we are guided by ethics. Yeah.
Daktari has started talking of psychiatric issues when I have said about having a V-shaped bum bum. So I dropped the whole thing. Rest, I'm started going through psychological tests.
Yeah.
Now, how safe is that? Trying to make my bums big or small?
So it's safe if you go to a trained plastic surgeon. But of course there are risks. And the highest risk is if you inject the fat into the blood vessel. And this is why we are trained for very long. Okay. So if you inject fat into the blood vessel, then definitely you can end up getting what we call an embolus, fat embolus, and it is actually quite lethal. So
What is that?
That is when the fat is transported by your blood vessel all the way to the lungs.
So you get what?
To the lungs.
Okay.
Yes. So when it goes to the lungs, it clogs the arteries in the lungs, and then you can actually die.
So we're actually talking of death here.
Yes, that's why you should not just have it. You need to go to someone who knows what they're doing. That's one. On that note, we do have what we call dermal fillers. So dermal fillers are synthetic products that we can inject into the buttocks. Probably if you have what we call hip dips, or if you don't want to go through general anesthesia, or if you have a scar or a dimple, a very small scar or a dimple that you need taken care of. Okay, so the dermal filler is not able to give you the kind of round bum you want, contrary to what you might see on TikTok or social media platforms. Okay, because we do have the limit of dermal fillers you should do. Okay, but for fat grafting, because it's your own, then you're good to go.
Okay. So dermal fillers is where I'm not using my own fat.
Yes.
I'm using artificial.
Yes, a synthetic substance that we actually buy.
Okay.
Yes. So
which can never melt if I sat on a hot seat.
Yes. That is a filler. That is a filler. It's there to fill. Yes. Yeah.
Wow. And it's something I'm putting in my body, so it will just be part of me. It will go well with the body tissues and all that and all that.
Now that is a bone of contention, because as plastic surgeons we're able to see, for example, if you put fillers on your face, and you remember I said I'm also a trainer in aesthetic medicine, so this is also quite touchy for me, because I do like fillers, but of course I do know, for example, if you do a lot of fillers on the face because you want to achieve a particular look, if you come later on to a plastic surgeon and they want to do a facelift, then the surgery becomes a little bit difficult because of the fibrosis. Not impossible to perform, but it becomes slightly difficult.
Okay.
Yeah.
I will come back there, and I will want you to tell us more that we're able to attain the shape of the face that we want to have.
Yeah.
But let's first of all finish with what is more juicy.
Yeah. Yeah.
So now, am I able to do my hips, to add my hips?
Yes, you can. Your hips, your buttocks, everything.
The
legs.
as you are saying.
Yes, the legs, everything. We call it augmentation. Anything you want.
Even
added.
The legs.
Yes, even the breasts. We can also put fat in the breasts. And we also, even for some wounds, we put fat in some of the wounds if we want what we call some stem cells, adipocyte-derived stem cells. They have some healing properties. So if we see a wound is very chronic, it's not healing well, then we're able to use some fat cells to bring about healing.
Okay.
Yeah.
Is it reversible? Can I have some bum? Maybe today I'm feeling like this is the size I would want, but later on I feel I want them.
You can remove the fat.
Okay.
Yeah, we suck it out. What we call liposuction.
Yeah. Now, when you're talking of fat, and me being a woman, and I know many women would agree with me, we want to do away with the fat here. We want to have flat tummy.
Yeah.
Now, when you're talking of this fat, can I do away with my tummy fat and be a flat tummy girl?
Now, that is actually most of the clients, that's what they want. They want that shape. They want a flat tummy and they want a big bum. Okay, so we're able to combine the surgeries, because you see the fat we get from your waist is what we are going to put in the bum. Okay, so that we call liposuction 360 plus a Brazilian butt lift in one sitting. Okay, so for a flat tummy, number one, it also depends with how heavy you are. Okay, so if it's just fat, because you have to come and we assess you first during a consultation. So if we feel you can get away with just liposuction, then we just remove the fat using cannulas. Okay, so it's, of course, definitely it's done in a very sterile manner. Okay, so you remove the fat, and if you don't want it transferred elsewhere, then we discard the fat for you. But if we feel that you'll have too much of sagging skin, what we call a panas, the abdomen that kind of flops like an apron, okay? Then in that case, we cut it surgically.
Oh my.
Okay, we cut it, and then whatever is left, because we'll cut whatever is hanging, and then whatever is left, we bring it down and stitch, yes. So you're snatched, literally, you're snatched.
Do I still have to observe the nutritional way of trying to be small, or once you've done that and you've looked it, I'm good to eat anything?
No, I thank you for that question, because that is a common misconception that people have, that once you've had liposuction, not liposuction plus tummy tuck, once you've had liposuction, that the fat cannot come back. If you continue eating the normal way you are eating, then definitely the fat will come back because your fat cells, they're still there.
Okay.
Yeah, okay. A bit of it is still there. So we usually try to tell you, as much as we've done the liposuction, kindly continue with dieting if you want to maintain these results for a very long time, and also gymming. Yeah.
What about tummy tuck?
For tummy tuck, you see now we've gotten rid of loose skin, so it's very
hard.
difficult for it to come back. And if it comes back, it's very slow. But it's not up to you as the patient to choose. That is the discretion of the doctor.
Oh,
Yes.
I cannot choose for you to do it so that I can...
No. If I feel you do not need a tummy tuck, you do not need a tummy tuck. And that's where we lay down the ground rules.
Okay.
Yeah.
So you tell me go and watch your diet.
Yes,
You're
yes,
not going
go.
to do all this.
Yes.
Wow. Now the breast. Once we have done the breast, maybe with my own fat or with whatever artificial addition you're doing, maybe I wanted them to be large, and now God blesses me with a child. Can I breastfeed?
With the implant, it might be difficult because of the position. Okay, but with fat grafting, yes. The thing about the breasts is, and this is a question we get a lot, there's both reduction, which is more commonly done in our country, reduction, rather than enlargement. Yes. So enlargement using the fat graft, that one, it's fine. It does not affect breastfeeding. So if you use an implant, definitely that's a story for another day. There are risk factors, but even before you come for the surgery, we tell you, depending on where we place the implants, it can either affect breastfeeding or not. If we put the implant behind the muscle, okay, or just above the muscle, then we have not tampered with the glands, the breast gland. You can still breastfeed, okay? But now if we put it just if we insert it just behind, it might affect depending on how that implant heals, okay? But that is a story for another day.
Okay.
Yeah. But what we mostly do, actually there are many foundations that that deal with this, is breast reduction for those who have very big breasts until it becomes almost like an illness. Yeah. So that we do breast reduction. Yeah. That's a major issue in Kenya.
Is it a major surgery? How long would we take?
So, for example, for me, if I'm doing the surgery by myself, I take 8 hours.
Okay.
Yeah. So first, there are surgeons, of course, who can do it at a much faster pace. Okay, and this is purely plastic surgeons. So for breast reduction, it's only plastic surgeons who, and also the general surgeons who've done a fellowship in breast surgery. Okay, so it takes around 8 hours. But if you're going to do with a colleague, then you can reduce the time to 4 hours, because now each surgeon works on an individual breast. Yeah, and they have to. They're sisters. They're not twins. They have to match, and it's a big surgery. It's a major surgery.
Okay. Do you reshape breast? Like I can feel I want a more beautiful.
Yes.
Or it's hanging now. I want it up there, not really reducing the size.
A lift. Yes,
you do breast lift.
It's called breast lift. Yes.
Oh my God.
And that is actually, it's a faster surgery, more technical, but faster. So if you feel like your breast, maybe you've breastfed, or because of age and gravity, it's sagging a bit, and you want them to be pucky, you come. So that is not breast reduction. That is different. We somehow just manipulate the skin and a bit of the tissue so the breast can come up.
Okay.
Yes, and the nipple can also come up. Yes.
Is that even the nipple? Oh,
yes.
Okay.
Because you don't want the nipple to be down there.
I know.
Yeah.
Does all that now again affect in case I want to breastfeed?
Yes, it does.
Okay.
For the breast lift, if we are only going to play around with the skin, not really. But for breast reduction, it will affect. So one of our criteria is you should have, number one, either you do not intend to have children, or number two, even if you have children, you do understand that it will affect breastfeeding. Yes, because of nipple sensitivity, sometimes you might lose it, and because in reduction, we actually get rid of excess breast tissue. So there, we are cutting the ducts. that supply milk. Yeah.
Wow.
So that one we tell you.
And can
for
we
sure.
later reverse? Now, if maybe at some point, has no reversal.
After-
Because I'm imagining sometimes maybe at our age, at 18, 20, 21, you feel like I've made up my mind, I don't want never to be a mom. Then maybe
Yeah.
at 25, 26, you start thinking, it can't be reversed.
You sign a consent because we have to. We've tampered with the breast tissue.
Okay.
So you have to sign consent that you actually understand what it is we're saying. And that's why for the very young, we rarely operate on very young individuals, unless probably it's an illness that caused the enlargement. Okay. Yeah.
Okay.
Yeah.
Wow. Let's come to the face. What are you doing to faces?
So we have, with the face, we have both the invasive procedures and also we have the cosmetic procedures, the aesthetic procedures. So starting from Botox, actually, let me start from the hair. We do hair transplant, we do Botox. Men love hair transplant. They do like hair
Is
transplant,
it?
yes. To get rid of the balding, forever young.
All right.
Yes. So yeah, hair transplant. Then for the face, Botox. What Botox is just paralyzing. I don't know if you can see. I actually have Botox on my face. So you paralyze the muscle of the face so that when you're doing facial expression, you don't cause too much wrinkling.
Oh, is it?
Yes. So that is what most of the people in Hollywood do. So you freeze your face at a certain age so that at 80, you still look 40.
Wait a minute. Okay.
It's the wrinkles that make you look a bit old, and also the lack of fat. The fat, that make your cheeks just go high. So if you want fat, then we put fillers. You understand? If you don't want wrinkles, it depends with how severe it is. We can do a facelift where whatever is sagging, okay, we actually open up and then we tighten. Now this you can see in Hollywood, it's a big deal. Yeah, so they totally tighten, and it actually takes almost 20 years off your age. Yeah, so reversal of time is possible. Because
Well, they were saying for men that before you marry her, make sure you see her in the morning when she's not having her makeup.
Yeah.
And now I see now Deja here. You will marry an 80-year-old. And we are thinking, but of course, maybe you can tell with the even the voice, there is a way to but you people where you are going.
Yeah,
it looks
true.
like at 80 someone will just be talking like this young girl and all that.
Exactly.
So you're able to do away with the wrinkles?
Yes.
And it is a very safe way of doing it?
It is safe.
Is it a surgery like you
It is a major surgery. But for Botox and fillers, they are minor, they are office procedures. Botox and the fillers, they're office procedures. There's also something called threads, though I do not advocate for it per se because of the fibrosis. Yes, basically. So I think what we need to see is where our country is now and where the Western world is. That is where we're going, regardless, no matter how much we try to stop it. So you can see where probably UK and the States and, those first world countries are. And now it's time for the third world countries to catch up, whether there's reluctance or not. We are catching.
Pesa wewe nikikushika.
Pesa wewe
nikikushika wewe. No growing on. Wow.
Yeah.
And does it have any major effect when you work on your face? Are you telling me I can look at, sometimes we see our celebrities and we admire, I want to be Rihanna, even the face, the shape. You are able to attain that through surgery?
You're able to attain that through surgery and also what we call regimens, skin regimens. So by the time you're probably 25, 26, you should, now what we advocate for in the aesthetic world, you should at least try and maintain the core pillars of your face, of your skin. So you need your collagen, you need to keep your skin supple, okay? So you need to maintain the water retaining capability of your face, the elasticity, you need to prevent the wrinkling, you need to ensure that there is enough fat in your cheekbones. If you need anything and everything, it's there. For example, you can use laser, You can use, and lasers for maybe skin resurfacing, you know, getting rid of acne, getting rid of marks, microneedling, Botox, fillers. We have the compounds that we use for the skin regimen. Okay, so right now, I'm sure most women have some form of skin care product that they use daily. Most might not know what it's about. Maybe you went to the dermatologist and you're just prescribed for something. But now this is where aesthetic medicine comes in. So for example, you know the key pillars of maintaining a youthful face. Okay, so you know you need your retinols, you need your vitamins, you need, you know, your moisturizers, your sunscreen. Yeah, so you basically, it's just science. Science is beautiful.
Okay.
Yeah.
Wow. There is this fear we normally have, and our mothers, when they were giving us example to discourage us from using and doing anything cosmetic on our faces, is that you may look so young, beautiful now and beautiful through the cosmetic things, and later in life, it turns against you. What is your comment on that?
No, that is true. That is very true. But that is why you need to go to someone who understands the effects. For example, as I said, I'm a trainer in aesthetic medicine. So there's what we call hyperpigmentation, or even the black skin. There are ladies who want to be lighter. What we'd call, they do what we call bleaching. Okay, but for us, we don't call it bleaching. We just call it treatment of hyperpigmentation or correction of skin color. So there's what you can do medically that is safe. And then there are products you can use. For example, hydroquinone. Okay, if you're going to use hydroquinone that is more than 4%, okay, then you're going to get what you call chronosis. Okay, and that is when you look at a woman and you see as if they've been burnt. You get by the products. And this is because probably they did not understand what they're using, the compound they're using, how it's working on their face, and the effects that it causes. As long as you know what you're using and how it works, you're good to go. That's why we say just go to someone who understands these things. Yeah.
There's this term you have kept using, and I want to understand that you are
Aesthetic, I'm a trainer in aesthetic medicine. Yes.
What exactly do you mean by that?
So, as much as I'm a plastic and reconstructive surgeon, so for the masters, there's a plastic surgery bit, and this is surgery, and there's aesthetic surgery. So, for example, facelift is aesthetic surgery. Okay. Now, on top of that, I got curious and I wanted to know if I'm not doing surgery and I want to use just medication to give a flawless aesthetics. Is it possible to do that? Yes, it is. So what am I supposed to use? What am I supposed to give? So for example, if a client comes and has acne, number one, I get rid of the acne and I get rid of the spots that come with acne. And there are compounds for that scientifically. And there's a reason as to why you do that. And there's a reason as to why you do skin brightening. So for example, if you have eczema and you come to me, yes, you can also go to a dermatologist. But also, if you come to me, then there are products that I can give, both medical prescription and also Korean products, you know, all these things. So what we look at is the chemical name. Even natural products. For example, if you tell me you're going to use centella, then immediately I know what you're targeting. Okay. If you tell me you're using aloe vera, then I know what is going to happen to your face already, even before you start. Okay. If you tell me you're using snail mucin, like in Korean products, I already know what you're targeting, what will happen. Okay. Yeah. If it's vitamin C, so basically it's that. Yeah. So the products, whether it's natural or chemical, and how it affects your body, both the ones you ingest, maybe IV therapies, the glutathiones, and also the ones you apply. So that's aesthetic medicine. Yeah.
So you're looking at me and you're thinking, this acne here, ni kujitakia.
I try not to comment, but what I do know is if your skin is very good, you have very good skin, then your makeup also looks flawless. Yeah. So if it's acne just for a bit, I know probably hormones, what. Now it goes to the medical bit. I'm able to quickly, just run
So
through.
the
Yeah.
skin color which you're calling recorrection, if someone wants to be a bit brighter and all that, you're able to do it in such a way that it will never like backfire on them in future.
Yes. So what? Now the thing is, you give the client what the client wants. For me, I do not cause harm. So if a client comes and says, I do not want skin brightening, I want skin bleaching, meaning you want to get rid of the melanin totally. Then okay, so when we want to do skin bleaching, there's what we are targeting. We have an amino acid called tyrosine. So this amino acid usually works through an enzyme, okay, called tyrosinase, and then it's broken down and melanin is deposited in your skin. So melanin is what gives you the black color or the dark color. So Africans have a lot of melanin, and it's not okay. It's actually the normal number as whites, but our melanocytes are more active. So it deposits a lot of the melanin on the skin. So if you tell me you want to bleach, then I know you need what we call tyrosinase inhibitors. Okay, so we have the safe ones. Okay, like the acids, the kojic, the alpha arbutin, all those things. We have the safe ones, and we have the unsafe one, which is hydroquinone. Okay, and it's unsafe because number one, it increases the risk of cancer, and it also causes that the burn that you see most people say, we amebleach na mechomeka. Then for others you'll say, hey, we amebleach vizuri. Okay, this is very good work. It's because they did not go for the hydroxyquinone. Okay, yes, we still use hydroquinone, of course, if indicated, but it has to be used by someone who understands what it's about.
Okay.
You understand? Yeah. So the lightening, now we can even inject what we call IV therapy. We inject the lightening or the skin brightening through IV therapy, meaning systemic. Yes.
Okay.
So it's possible.
All these things we are doing to this girl child, even as we aid. I know you don't want us to aid, but we have to.
Yes.
All these things we are doing to this girl child.
Even the boy child also bleaches.
Or even the boy child.
Yeah.
And actually, I want you to tell them better about the bam bam about men. I think many men are not very comfortable having bam bam. I was going to girl child because I want to talk about being a mom.
Yeah.
All these things we are doing to a girl child, are we making this woman at a high risk when now it comes to giving birth, breastfeeding, the changes that comes with our bodies when we give birth? Are we interfering with the whole cycle, or are we okay?
No, it depends with what you're doing. So for example, if it's breast reduction or even maybe the breast lift using the more invasive techniques, then you do understand you're kind of altering some things. Okay, and that's why you have those caveats that we talked about previously. But most of the time, for example, after childbirth, for example, if you want to retain your tightness, of course, everything goes back to normal, and you see a plastic surgeon or a cosmetic gynecologist to get vaginal tightening. Is that really a bad thing? Would you consider that a bad thing? It can actually even save marriages, So I think what is good and what is bad is what we think is good and what we think is bad. But it varies from person to person. And it's a very private affair. Someone might actually be talking about it out loud as being bad, but they're actually exactly, yes. So it's a very individualized kind of treatment.
Okay.
Yeah. Then if it helps with your self-esteem, is that a good thing really or a bad thing? Yeah. But to each their own.
Okay.
Yeah.
Okay.
Yeah.
So if you're struggling in your marriage because you're feeling like things are a bit loose, not as tight as you would have wanted them, you just need to look for Dr.
Yes.
Makena.
Yes.
And she will make
save your marriage. Yeah.
Is there anything
Okoandoa.
you're doing for men when it comes to sexual whatever?
Yes, there is.
Uh-huh.
So if a man wants enlargement, we're able to cater to that. Yes. Now, this is not the one for pills, take a pill. No. So if you want increased width, then we do the fat grafting around. So you get increased width. If you want elongation, though it's, for me, I do not do surgical elongation, penile elongation, but I do have colleagues who do it, who offer it to their clients. But for me, I feel the dangers outweigh the risks outweigh the benefits.
Okay.
Yeah, but for increasing in width, sure. Yeah.
Where are you increasing in width?
To each their own. That is all I can say. That is all I can say.
Pima, they measure the wife, or it's a standard way of doing it. So wherever he takes it, it will still work.
No, that is for him to know. Yeah, we don't ask you to come with your partner.
Do you think you're risking marriages?
We are giving treatment to our patients. Yes, to our patient. Yeah.
Okay.
Yeah.
I'm even imagine when you make it longer, will it throughout? Will it stay long? It's now the normal way when blood is pumped there.
No, for me that's the issue about elongation, because you can do elongation and then it does not function. So because you cut the suspensory ligament and then it's difficult to achieve elongation. So for me, I do not do elongation at all.
Okay.
Yeah, because I believe surgery and medicine should make you better, not worse. Yeah.
Wow. What a beautiful discussions that we have had today. And this one is exciting. This one is rare. And you want to ask me, Susie, why are we having this discussion? It's because what Dr. Mercy have been repeating, to each
their own. To each their own.
Their own. And confidence is, as I started by saying, confidence is everything.
Exactly.
If you feel there's something inside of you that is causing you lose your confidence, lose your self-esteem, I don't think we are having two lives here. I know we have another life. So I don't see we only live once. For me, I don't just live once. I know I have another life that will come.
That's true.
But in this current world, because I hear the other world will actually have new bodies.
Yeah, that's true. Yeah.
So in this, it's only in this world we are allowed to do the experiment with all these what we have. And I love and like the fact that you're saying it's something very safe to do, as long as we are doing it and I think that's why it is important for us to have these discussions, because you know it, by the way, these things people are still doing. They have been there. Even when we were in secondary school, we could see women who are trying to apply things to become lighter.
Yes.
Now the problem with that is because we want to do it hiding, we get to the wrong hands.
Exactly.
But now when we come out and speak and we are telling people there is the right way you can do it, then I think we save a generation.
Exactly.
So we stop pretending like it's not.
Yeah.
We have gone to so many baby showers and we are trying to tell women how they can make their sexual life good and all that. We are trying to tell a woman after birth what they can do to retain, to gain back their tightness and all that. So the truth of the matter is what we are talking today, it has been talked in whispers.
Exactly. Yeah.
And the whispers has made them to be done the wrong way.
Exactly.
So, Daktari, when I come to you and I feel like, hey, my body is really misguiding me. I'm not having enough of these things and I want to do away with it.
Yeah.
You are able now to do what maybe in the old way we'd call it FGM.
So personally for me, I do not do it at all. Reason being, I carry the stories of my clients with me. So I do not practice FGM or FGMC at all. So if you want to cut the clitoris, if you want to cut off the labias, as a preference, I do not do that.
Okay.
Yeah.
You don't want to help us with the morality too.
For me, I do not. I totally do not.
Okay.
Yeah.
When we get to childbirth, is there what is too tight and what is flexible? But mtoto cannot come through here unless you do CS.
We have conditions. We have conditions that make the vaginal canal very tight, it is usually actually quite difficult to reverse that. Okay, after childbirth or just normal, if someone wants vaginal tightening, then you can have it surgically done, or you can use laser. There's what we call EVA. Okay, so you use laser to make it tight. So whether it works or it doesn't work, that is for the partner to figure out. However, after delivery or even just normally, we do ask women to practice Kegels so that you're able to exercise the perineal muscles. So that is what usually causes the tetanus, when you're able to contract and relax. So if you're able to do just Kegels, then essentially you should be okay. Unless now you want to go an extra step and feel like you're a bit more tight, then now that's when you come for vaginal tightening. Or if probably you feel like you tore apart during childbirth and you want things restored back, so you can come for a vaginoplasty.
Okay.
Yeah.
As we had the show, Daktari, I want to understand why did you get that interest towards that? Why are you doing all this?
Yeah, so I know it seems like a taboo. These seem like taboo topics, but my interest is just generally helping women feel better about themselves and also get rid of body shaming. And because I know this is what has been talked about in hushed tones for so long without any local solution, I feel I need to bring to the public's notice that whatever women are suffering from, we do have solutions for you. Okay, even couples, whatever you're suffering from, kindly do not end up depressed or sick just because of that. We do have solutions for you. Yes.
Some of these things we fear because we think they can cause things like we're told cancer and all that. Do we have those severe side effect, like they can cause one to have cancer and all that?
So it depends with what you use. So, the process of cancer comes because of alteration probably in the genetics, the DNA, and all. Okay, of course, what we call apoptosis is, or senescence. Okay, but if you're doing surgery, you're not causing the cells to overgrow. Okay, so in case you're to get cancer, it's probably because you are already going to get it. Okay, but does it put you at an increased risk of cancer? Not really, unless you already had the markers. Okay. So those are myths, and we are here to bust the myths. Yeah,
drop them.
Yeah,
learning and relearning. Remember, we said that.
Yeah.
What are other ways that maybe you use, maybe for our bodies, maybe in terms of weight, abdominal, whatever fats? What do we call them? Those. What is this that makes us not have flat tummy? What do we call them?
So and this is usually it brings a lot of confusion in the industry. So plastic surgeons, what we do is body contouring. So what we call tummy is not really tummy, it's the abdomen. Okay, so us, we just deal with skin, the muscle, and the fat. Okay, but general surgeons, especially bariatric surgeons, are the ones who deal with weight loss surgeries. So in that, for example, if you want to reduce the size of your stomach, not this stomach that you can touch, the internal stomach, the one that holds the capacity of food. Okay. So if you want to reduce it so that you're only able to eat small portions, so that you're able to get generalized weight loss, then you see a bariatric surgeon. That is different from a plastic surgeon. So first you lose the weight, and then you come to us for us to fix your external body. So whatever is hanging and the fat that is overhanging, then us, we do what we call body shaping or body contouring through liposuction and tummy tucks. Okay? Yes. What we call abdominoplasty. But if you want to put the balloon, yes, we can also put the balloon, but that is weight loss. It's part of bariatrics, which is very different from plastic surgery. Yeah.
Ask, is it reversible? Can I remove the balloon and go back to my
Yes. So for the gastric balloon, once you put it, there's one that can dissolve. In 6 months or 1 year it dissolves, and there's another one that you can actually remove.
Okay.
Yes. So the point is to make your stomach feel as if you're full.
Okay.
Okay, so the space left is just quite minimal. So you get full very fast. So you also get the general weight loss. And then now after you're done with that, then you come to us. But now these are cutoffs. So their clients will walk in and we're like, yes, we can do liposuction immediately. We can do tummy tuck immediately. But if you're morbidly obese, then we'll ask you first go do a weight loss surgery or weight loss procedure, and then after you've lost a bit of weight, then come we do the body contouring. Okay. Yeah, but first you can actually come to the plastic surgeon, then they'll advise if you're a direct candidate or if you need to do the weight loss procedures first.
Okay.
Yeah.
Allow me to think like a layman person and think instead of, okay, well, it's also an option. Putting a balloon is an option, but on the other hand, is it the same impact if I'm psychologically well set that this is the amount of food I'll be eating? Is it the same impact when I have a balloon and when I have prepared and worked myself psychologically that this is a portion of food I will be eating in the next 6 months for me to gain a certain kind of weight?
Now, what I do know about the body and the mind, and this varies. There are people who are able to set that mentally and they're able to achieve it. There are those who are able to take some medications, okay, some supplements, some hormonal supplements to reduce appetite, okay, and it works. But there are those who it just does not work on them. Yeah, so those are the ones who will need the extra help from us. Yeah.
Beautiful. Daktari, I want you to look at the camera and maybe tell us anything else you think we ought to have known from our discussions that we have not said.
Okay, so other than the plastic and the aesthetic bits, we also do reconstructive surgery, and this is for all patients who have congenital deformities. If you have skin tumors that you need removed and probably caused a defect, and you need restoration of that particular beauty that was there initially, then we are also able to restore you to the natural state, the normal state. So reconstruction is actually done to a larger degree in Kenya rather than the aesthetic and the plastic surgery bit. So for example, if you're involved in an accident and you lose part of your muscles, then you go see a plastic surgeon. If you lose the tendons on your hands, you go see a plastic surgeon, okay? If probably your finger is cut the tip, you come to us, we fix the tip, okay? If you lose your hand, you come to us, we fix the hand, you get? So it's not just plastic and aesthetic surgery, even the reconstruction, which is actually what we do most of the time. Yeah, so in this particular field, there's also what we call gender reassignment, and this is something we even do not talk about in Kenya. For example, if you're male and you want to turn to female, that is what we do. We remove the clitoris, we remove that, we give you a different set. We change your, but you see, that is not where our discussion is going today. Yeah. So gender reassignment is actually not practiced in Kenya. It's practiced in other countries. Yeah. So that is a discussion for another day. Yeah.
Okay. Beautiful. We have come to the end of the show, and thank you so much, guys, for watching this video. Please comment and tell me what you think about this whole idea and any question that you have. I know I'll ask Daktari to give us her contact so that in case, that is, if you are comfortable with that, in case you want to reach to her and you want to get to know any other detail that you would have wished we have asked and we haven't asked, maybe, Daktari, how can we reach to you?
So you can get me through my number. So 0723 746 684. You can also contact the clinic. So it's Mirazi, 40 Suits, 8th floor, Upper Hill. Okay, so if you just Google Mirazi, you'll find the contacts there, and you ask for Dr. Makena. You can contact me through TikTok, Makena Mercy. You can contact me through Instagram also. So all the social media platforms, basically. Yes. But the easiest is probably TikTok. And even Facebook is a bit difficult to contact me, but I'm also on Facebook.
Okay.
Yeah. Wow.
Facebook mulituachia sisi wazee. We have heard you people talking about it and we are not faking you people. Mulituachia Facebook. Ni sawa tu.
And LinkedIn, also LinkedIn. Yeah, I'm also on LinkedIn.
Okay,
Yeah.
as Mercy Makena.
Yes, Makena Mercy.
Makena Mercy,
Or,
Dr.
yeah, or
Makena Mercy.
Dr. Makena Mercy or Makena Mercy.
Oh.
Yeah. Depending on
And
the
of
social media.
course, when you get there, this beauty you cannot confuse with anyone.
Thank you, Suzanne.
Thank you so much for coming.
Thank you for having me.
Thank you for the information.
Thank you so much.
We are loaded.
Thank you.
I know women are smiling.
Yeah.
Even men, they should be smiling.
They should be
this one.
smiling. Yes,
Right?
they should be smiling.
Wow.
Public education is very important. Yeah.
Before we end, let me ask, you've talked of the age. We are trying to reverse our age. Can I reverse when I am at 80?
There's a cutoff.
Okay.
Yeah, for each and everything, there's a cutoff. Okay. So after a certain age, and you've already gone through the entire aging process, there's very little that we can do. Yeah. Oh. Yeah. So get in touch with your plastic surgeon when you still have when the sun still shines. Yeah.
Wow. Thank you so much. Thank you guys for watching. Please subscribe. Have you subscribed to our YouTube channel? Why haven't you subscribed? Kindly do so. Subscribe is a way of supporting us, and it doesn't cost you anything, but it's just a way of making sure we are growing and we are reaching out to as many. And again, if you want to share your story here with us, if you want to give us an educative session like just the one we have completed, you're much welcome. Here we do not fear, because we want to encourage people to talk things real as they are. We are, Doctor, you said you are tired of women going face down?
Yeah.
That's why you are so bold on this?
Yes. We need to walk with our chin up.
Okay.
Yes.
Bye.
Goodbye.